Dr. Luciano Caixeta is with the University of Minnesota. He grew up in a family of bovine veterinary practitioners in Brazil, and that's also where he earned his DVM degree. He then went on to Cornell for a PhD and a residency there, and then to Colorado State University for 2 years as a clinical instructor. And thereafter, he joined the University of Minnesota Department of Veterinary Population Medicine, where he's now an associate professor. Luciano's research projects are very applied in nature, and they generally answer questions that are asked by dairy producers and veterinarians. And especially, Luciano has been involved in direct and indirect efforts dealing with metabolic problems, starting with cows in late lactation through the dry period and through early lactation. So with that, I will turn it over to Dr. Caixeta, and go ahead and share your screen, if you would.
Thank you, Amy, and oops. Everything shows up on top of your...
Looks wonderful.
Okay, let me just move some things out of my way so I can actually see my slides. Because on my screen, I have everything, but thanks for the introduction, Amy. And as you said, like, feel free to unmute yourself and ask questions. It's easier for all of us, and you won't forget any of the questions, and it makes more sense to ask it as they happen. They come up to you because it makes it's just easier. It makes more sense. So feel free to interrupt me if you have a question. So as Amy said, I'm Luciano Caixeta, associate professor here at the University of Minnesota, and I do a lot of research, and I see that I have like 2 different topics that I do. One is, they all involve management, and one is metabolic diseases. So I have quite a bit of work on I did a lot of hypocalcemia before, but I do a lot of ketosis work now. And I do work with mastitis. And then because of the nature of those diseases, I work with a lot of management of cows from dry off all the way to 60 days post-calving. So I often say that I work and I like to work with cows by the time we dry them off, all the way to the point when we give them to the repro specialist, and they can carry on with all the magic that they do. I actually started working with reproduction and metritis, and it quickly evolved, if you ask me, but like move on to different things that establish cows as successful for their successful animals. So, and my conversations with Amy, we decided to have, there was a lot of topics that we were discussing. The main one was blanket and selective dry cow therapy, which we have done some very interesting work in the state. And I have the pleasure to work with Dr. God and Dr. Royster here at the University of Minnesota, who have been working on this for much longer than I do. But I've been incorporated to their team and have done some lead on my own, some of the projects. And then there was one topic that was teat sealant. So I'll incorporate that into the blanket and selective dry cow therapy to tell you and discuss with you what the importance of this and importance of hygiene. And then the second part, which is will be a shorter part from the whole presentation, it is some considerations of high producing cows prior to dry off and some grouping strategies. It's a very high level. It's basically 1 or 2 slides that I have. We're gonna get discussions, and I'm happy to entertain questions. I have done a work with some pharmaceutical companies in some of the products that are here on the market to try to enhance and make it easier for cows to transition from lactating into dry cows. I don't have the results in this presentation. Happy to chat about it, but I purposely didn't put it on because that was not the main topic for this conversation today. But going on in the first part, I'll talk about selective dry cow therapy, blanketed selective dry cow therapy, it's a topic that has been a hot topic for the last decade. So some of it started because of the pressure from general population to have a more judicious use of antimicrobials in farms, and knowing that in conventional farms, the majority of the antibiotics are used for treating mastitis in the adult population. And when we look into that, a lot of that is used for cows that dry off. So that was an easy place for us to think about how can we use fewer antibiotics. So that's something that we're going to talk about it, the blanket and selective. And like I said, Dr. Godden, Dr. Royster, Dr. Darren Neidham at Cornell, who collaborate with them, have done a lot of work. You're going to see a lot of the names here. There's Sam Rowe, was a graduate student here that finished in 2020, that did a lot of really good work, and you're going to see that the product of his work is coming out. It's published and it's available in literature, and I'll have some of those results here. But basically, when we come back to the core question, or the main question, which is what's selective and what's blanket dry cow therapy, and that is what you all being exposed to, and the reasons for those and the difference. I hope to explain a little bit here, but we all know that at dry off, when we look at the population of cows, like all the cows that we have to dry off, we do have cows that they either have a clinical mastitis that's active now, or they were clinically mastitic or have a mastitis event not long ago, or you have those cows that are high somatic cell count for a lot of their lactation. And if we don't do anything about those cows, if you don't treat cows, they are high somatic cell count at dry off, they'll come back into the next lactation also with high somatic cell count. We actually, and I don't have the graph here, but we look into data from organic herds, for example, where they cannot do antibiotic therapy or at dry off. And we noticed that, and the association, we found that the cows that, for example, the cows that had the last 3 DHI tests that were above 200,000, so above a linear somatic cell count score above 4, because they're not treated, when they come in the next lactation, they stay higher, and those cows then in the following lactation just stays higher for the whole lactation. So those cows with high somatic cell count, which is actually the basis for one of the ways of doing selective dry cow therapy, are definitely cows at risk. So if you think about the picture that I have here, see if I can get a laser pointer to make it easier. If you speak about your whole population, you have a good part of them, like the majority of them actually will not need a treatment. So those are cows that are not at risk, while we have a part of the population that's at risk. And it could be part of the cows or some quarters there. But many decades ago, the mastitis problem was in a very different situation than it's now, and it was widespread, and it was hard to maintain and to contain those infections. So the recommendation at that point, because we wanted to get a good handle on mastitis, was to just treat all your cows. Like, it's really hard to not get them contaminated or infected during dry off. We didn't have teat sealants at that time, so the recommendation was every cow drying off, which is the blanket dry cow therapy, should get antibiotics. So that was it still is, and that was the gold standard for many decades, because we were still dealing with a lot of problems trying to maintain other health of the cows. So what was that brought us to is, by doing this, we were able to get a much better handle on the mastitis problem. And we also have improvements in management, in housing, all those things to lead to a lower risk of cows being infected. So just basically better handling of mastitis, which then gave us the opportunity to be more proactive about. We know that the majority of my cows or the quarters in my cows do not need treatment. So why I'm giving antibiotics to those, which is an expensive treatment, if it's not necessary. So that's when, with also some of the society pressure and also the need and our efforts to do not contribute as little as possible to the selection of antimicrobial resistance, we start working to selective dry cow therapy that then now just differentiate from blanket dry cow therapy, just because now we only treat the quarters or the cows, depending on the protocol we're using, they're at risk. And when I mentioned the protocol we're using is because there are two ways to actually carry out selective dry cow therapy. And that's what I'm going to have in the next few slides, and I'll compare to you what are the differences. But as I said, in the last decade, a lot of research has been done trying to establish if this was actually feasible. And what we found out through lots of studies in commercial farms is that selective dry cow therapy indeed reduces the use of antimicrobial, the use of antibiotics, which is obvious because we're not treating all the cows. And that reduction can go between 21 or 58%. It depends on the strategy you're using. But the most important thing that was found is even by reducing it, being more judicious and proactive on the only treating cows that truly need that treatment, the negative impact on cow health and performance didn't happen. So we're doing this, we're being proactive, using less antibiotic, and we don't have an impact on cow health and performance. So that's very encouraging, and that's what some more farms are still trying and investigating, or at least being curious about utilizing selective dry cow therapy. So with that, we think, well, we're definitely saving money by not having all these intramammary antibiotics that we're giving. So let's all do this. That would be the thought process. However, that's not the case. So there is evidence that if this is implemented in farms that are not ready for it, it can become a bigger problem, which then will revert us back to that situation we had many decades ago when it was established that if we give treatment to all cows, we will be much better than not giving. So that's why we have this here. The second statement saying that selective dry cow therapy, it can be implemented successfully, but it's only for some appropriate herds. And that's something that I'll also touch base in the next few slides. But then going back to that comment that I made, the two different protocols. So if you look in there, we have the culture-based or the algorithm-based selective dry cow therapy. And the main difference of those is the fact that if you're doing culture-based, which means that you go to a farm and a week or a few days before dry off day, let's say dry off is on Monday, the Monday before, or someday before Wednesday or the previous week, you go there and you collect a milk sample from each quarter of the cow and you culture it. If anything grows on that culture, and let's think in this bottom left quarter here, if you have a cow and you have left front, right hind, and left hind, anywhere that's a grow, so all quarters but left hind had an infection. So if we were doing a culture-guided selective dry cow therapy, this cow will be treated in all quarters but the left hind. So if you're using a culture guide, you can do that and treat only the quarters that are at risk. The other option you can have is if you are testing monthly or at least on a regular basis, at least 8 times in a year, you can use the data from the selected somatic cell count information that is available through your test to determine which cows you would be treating. So usually, and there is different protocols for algorithm-guided selective dry cow therapy from different parts of the planet, but usually in general, what they use is if a cow has high somatic cell count, it's a chronic cow with high somatic cell count for many times, she's at risk. But if the cow that has somatic cell count, high somatic cell count in the last 3 tests, so very close to when we're drying her off, she's also a cow at risk. So those are things that will go in the algorithm-guided selective dry cow therapy, and it'll give you a flag saying like this cow is at risk, so she should be treated. However, the biggest difference between the algorithm-guided versus culture-guided is the fact that in the algorithm, because you're using the data of some somatic cell count to using the cow data, you don't know which quarter truly is at risk. So because you don't know that, when we are treating cows, we're treating all 4 quarters of the cow because we know this cow has high somatic cell count. It could be that she has only 1 quarter that's very high and the other ones are virtually 0, but you don't know that. So we treat all the cows, and that's it's a safety net for us, right? So when I explained this way, you can see obviously that those different approaches are not really selecting the same cows or the same quarters per se to be treated. However, even treating those somewhat different quarters and cows, we saw on both those approaches the same effectiveness and the same lack of being prejudicial to those cows. So both algorithm and culture-guided selective dry cow therapy are effective. And then when we look into here, you have the average savings, and you can see that the savings that was calculated for the algorithm is much larger, so almost $8 per cow compared to $2, almost $3 per cow in guided selective dry cow therapy. And the main difference here is the cost of the plate, because you're using a plate here to make your decision and not a plate when you're using algorithm-guided selective dry cow therapy. So there is a bigger savings for using the algorithm-based. But that is when we did the calculation, I mean when they did the calculation, they didn't account for the cost of herd testing on a regular basis. So there is a little bit of just considering that the people will have access to that information. So then this will be the savings. So the reasons for this being effective and the savings come from the relative expensive dry cow therapy products. Then we reduce the use of those, and you don't have overall problems afterwards. And if you have more interest, there are actually some, and I have this, you have the access to this calculators. You just have to click on the link, and send you to a page that looks almost like this, unless they have updated, but I think it's still like this. So it's a selective dry cow therapy cost calculator that was actually developed by Sam Rowe when he was here and with the team. So you enter information, what's the number of cows that you want to dry off per year, if you have the HI test or not, and then your cost of tubes, your cost of internal teat sealant, and then that will give you, using some mathematical or economic modeling, will give you like what will be the cost for each approach. And then that's when we talked there in the previous slide about the savings is this part. So if you were to give blanket dry cow therapy, so my cost with medication and labor will be this for a given number of cows, then we'll decrease it if we have algorithm-based or culture somatic selective dry cow therapy. So this is a good tool that can help you if you're ready for selective dry cow therapy. And again, like I said, the algorithm, we have that, and the basically is just explaining again how the culture base will work. If you have growth, you treat. No growth, teat sealant alone, no treatment. And this is a good choice for farms that are already practicing on-farm culture. So they already have a routine protocol that they know how to collect samples. So the milk samples are not contaminated. So we have an effective and culture results that it can work with. Or in places where they have nearby lab where the response and the results can be offered rapidly. In a way, it is an inexpensive result compared to some other high throughput and more evolved methods, but it's still it's something that you need to have some capability of either on-farm culture or be close to a lab to get results fast. And if the farming case is not on DHI and it's interested in some selective dry cow therapy and they're not going to test, then this is actually the approach that will be recommended. On the other hand, the algorithm-based, like I said, they would use cows with high somatic cell count and clinical mastitis history will be considered a risk. So the cows will receive all 4 or 3/4 of the cow will receive antibiotics if any test during the year is above 200,000 cells per ml, if they have 2 or more cases of clinical mastitis, and if they will have almost like an active clinical mastitis, so a clinical mastitis in the last 14 days before dry off, those cows are at risk and they will be treated. This is definitely a good choice if you're already on DHIA because you're already getting one of the most important information here, which is not collected at the farm, right? So not collecting the farm records by farm personnel, the cell account. And if the farm is not processing cultures, if it's not practical or it's not available for the farm, then this is a good approach for selecting or starting selective dry cow therapy. And then this is something that the DHI, and I got this information with the help of Amy and also Dr. Erin Royster had this before. So the dry off strategy by using DHI, there's the DHI 370 Flex report. They'll come like this picture on the right-hand side here. So you have the cow information, and then you have her actual somatic, so the previous somatic cell counts, and you have some history, not in this format of the report that I have here, but you have her history of clinical mastitis, and then you decide if she can, if she's at risk or not. So what they would use is, like I mentioned, 8+ DHI tests per year. And the herd to be eligible and to be a good place for this approach has to be with average somatic cell count below 250,000 on the bulk tank somatic cell count. And the cows, the herd itself should have less than 3 DHI tests over 250,000. So those are things that are minimal parameters to be using this approach, and the eligible cows within your farm will be determined based on her own performance, quote unquote, on the test. So they have to have low somatic cell count, so less than 200,000 in the last test, and the average of the last 3 tests also should be less than 200,000. If we do this, and if the cow does not have mastitis in the current lactation, the dry off period is not too long, she doesn't have signs of clinical mastitis at the time of dry off, or it's no history of being a chronic mastitis, those cows are eligible to not receive treatment. So they'll come in as green shaded in your in your report, and then you can make a decision if you're going for selective dry cow therapy. So from this list that we have here, which are we have 10 cows, we have only 4 cows that will be treated. All other 6 cows do not need to be treated. So which will save you in antibiotics and to save you some time because it'll be a little faster. So when I talked about it and I mentioned early on, it's like selective dry cow therapy, it's a great tool, but it's not for everyone. So the questions I will ask and the questions you need to think about when considering selective dry cow therapy is, do my herd have a low prevalence of infections at dry off? And this is one thing to happen, and I know it's hard. We're not testing all cows at dry off to understand if there's infection or not. So a good way to think about it, and I think it's somehow a proxy for it, is my bulk tank somatic cell count below 250,000 cells. So if you are a herd where your somatic cell count is below 250,000, then you are someone that should consider selective dry cow therapy. If your somatic cell count is above that threshold, then we need to work on a few other things before you will be eligible for selective dry cow therapy. The other thing to think about is, how is my control of contagious pathogens? If I'm a herd that I'm constantly struggling with Staph aureus, Mycoplasma, Klebsiella, and all those things, it might not be advisable to go this route because we might be not treating some cows that would certainly benefit from that treatment at dry off, just because that specific time point when we're testing that cow, she doesn't go into the high risk category. So by going into a place where we're withholding treatment, antibiotic administration to some animals might be harmful to the cows. So in this case, if you have not a good control of those pathogens, it will be better and we're advisable to not go into selective dry cow therapy protocols. The one thing that I'll have, and I'll have both of this, bring those both together, is proper use of teat sealant and proper dry off procedure in general, because teat sealant is only used at dry off. And by that, what I mean is clean, clean, and clean. That's the key in here. And it's especially because when we think and we're talking about selective dry cow therapy, we're talking about withholding antibiotics from some cows, but administering internal teat sealant to all cows. And by why being clean becomes very important in this situation is, if we are infusing cows with internal teat sealant, but we're not careful to be clean and hygienic, we might be introducing something by infusing that internal teat sealant, and we don't have that buffer or that safety net, which would be the antibiotics that we're infusing prior to internal teat sealant. So that's one of the things that it's not that we shouldn't be clean if we're doing a blanket dry cow therapy. We also need to be very clean, because even in blanket dry cow therapy programs, we still see some toxic mastitis happening after dry off, one that cleanliness is not appropriate. But it is even more important if we're using selective dry cow therapy, because now we have cows that do not have intramammary antibiotics, and they can suffer from a infection that is caused by the introduction of it with the internal teat sealant, because we, as caretakers, did not have good hygiene and cleanliness. So some of the excellence in dry off comes from knowing when to dry off our cows, and many times we are constrained based on the fact that the cow needs to be dried off because she's gonna calve in 60 or 45 days. But other times, other things that we should think about it is like, she's producing too much milk. Can we reduce that milk leakage? That way we reduce the chance of that post-dry off opening of the teat, which is a door for the entering of the bacteria. So those are things to think. And then, as I mentioned, the procedure, dry off procedures, mainly the intramemory infusion of antibiotics and teat sealant, should be very clean. And you see here a picture, use the alcohol pads that come with the products, or if you don't have that, create your own of gauze and alcohol, and do a very good cleaning of the teat end before you introduce those drugs, those um, tubes, to make sure you are not introducing any potential pathogens that will cause mastitis or intramemory infection. So you go there, you do all the prep, milk the cow, clean it, and then you clean the teat end before you put the antibiotics. And then oftentimes you do antibiotics and you have another person doing teat sealant. But if you don't, even if you don't, it's always good practice. You clean that with alcohol, antibiotics, clean it with alcohol again, teat sealant, and then post deep, and then the cow is done. So always go for the most hygienic and the most clean you can be for this dry off, so we don't cause any harm to those cows. Teat sealants are very important, and it's a topic that we always talk. And teat sealants they were a very important player in the betterment of other health management. So yes, we as an industry, we were very good about treating and having blanket dry cow therapy to decrease the infections and environmental mastitis and get a good handle on those pathogens. But it was also good with the advent of those teat sealants to decrease the chances of cows not having a closed down teat after they dry off. So basically, what a teat sealant is, it is just an artificial or a something that we put in that will serve as a sealant for the teat end. So we're trying to just make sure that the teat end is not open to the outside. And naturally, what happens is if you leave a cow post dry off, she will produce a keratin plug that would have served as a teat sealant if she was left alone for her own devices. And this keratin plug, if you look here, get your attention to the right corner here, the right picture on the right most to the most of the right here, you can see this is an X-ray actually of the teat after teat sealant is it's administered, and you see that all the white part here internally is all the teat sealant that you put in. If you look at the middle panel here, you see the person properly administering it by holding the base of the teat and infusing teat sealant. So that's how it would look like. So you just have this physical barrier that is in there in the teat canal that will be here, but also in the teat cistern here to prevent any bacteria coming from the outside to go all the way in. So that's what the teat sealants are doing. So it's just a way that was developed to have us make sure that we have this physical barrier between the outside and the mammary gland to make sure that no new infections will happen. And the reason that's has been very useful is if you look at the epidemiology on when the infections happen, there are 2 times in the dry period when the infections are more likely to happen. The first time is like right after dry off, in the first few weeks, because the cow is still producing some milk. So they have a lot of this very nutritious substrate for bacteria to grow. And if you have bacteria go in, they'll go there and have all these nutrients to grow, and then you have established an infection there. The other time that it could happen, some of the infections, is when they start producing and getting ready to produce milk and colostrum again, so close to calving, then you have this increase in the substrate that's nutritious and will support the growth of bacteria. So by using internal teat sealants or teat sealants, for that matter, at dry off, we are trying to, and we are preventing these new infections from coming in. So by closing in the quarter, closing in the teat, we have this physical barrier preventing mastitis to be settling into the teat as we are drying off the cow. So using teat sealants have had a tremendous effect on the overall management of and other health in the dairy industry for those reasons. So it has been very important to maintain the cows from getting new infections. And then going back to the characteristics that I heard you have for implementing selective dry cow therapy, the last one that I would like to bring out is the ability to monitor outcomes. So if we're going with selective dry cow therapy, we are going with a different protocol that could potentially cause a lot of damage in other health. And we need to know if that's happening, because let's say we start trying selective dry cow therapy, and then the first few cows that are calving in, you already see a lot of more clinical mastitis, higher somatic cell count. So we can still try, and we have another now 4 to 8 weeks of cows coming in that did not have all cows receive internal antimicrobials. So it could be a problem. So we need to have ways to monitor if the other half of my farm is suffering because of this protocol we're using. So a few ways we can look into that. As I mentioned, clinical mastitis in early dry period or clinical mastitis in early lactation. We have them both here. Oops, let me find my both here. We can see what's the dry cow infection cure. So we're having a lot of new cases, cured cases, clean and chronic cases. Are we having a good dry period length consistency? So we don't want to withhold treatment for those cows that will have really long dry periods, because it can have other issues. So that's something to really consider. But usually we often will see most of the outcomes being early lactation or the risk of contagions and pathogens. So looking into clinical mastitis in early lactation, somatic cell count in subclinical or subclinical mastitis in early lactation. And for the herds there on dairy comp, there's really good ways and easy ways to get that information, and a 2x2 table on your dairy comp that will show you like how many new cases I have, what's the chronic cases, and the cure rate on subclinical mastitis. So that is something to certainly consider when implementing this approach. And you can always maintain or have a good idea of the herd level based on the bulk tank somatic cell count. Bulk tank culture can be used to screen for contagious pathogens. And if you have routine culturing of clinical mastitis through lactation, it gives you a good understanding of what's the epidemiology or what are the cases that you're having in your farm. So considering those monitoring parameters, very important to make a decision or to have those in place when you start doing selective dry cow therapy. Then I'd just like to bring it up to a few projects we've done here. And it was not long ago, towards the tail end of the pandemic, there was a shortage in intramammary tubes. And not only that, there was, like I said, there's the industry evolved, and we have a better handle on it, and we feel like we don't need to really treat all cows. So what we looked into is, can we just not treat some cows? So we work with a group of farms here in Minnesota, and can we just not treat cows? So half the cows randomly receive internal teat sealant and antibiotics, and the other half just got internal teat sealant. So we basically just try, like, let's just try to not treat some cows. And those were all multi-pairs cows. And bottom line is, that's not a good idea. The results we have is if we just stop treating cows without any testing, the risk of clinical mastitis in the first 200 days in the next lactation was higher. So the cows that receive antibiotic had a lower risk of having clinical mastitis in the next lactation. And those cows that have intramammary antibiotics and teat sealant were also had a lower risk of being culled or leaving the herd. So stopping treatment of cows without knowing if a cow is at risk or not is not a good idea. So we don't recommend the herd seeking to improve antibiotic stewardship, or once you look into selective dry cow therapy, just randomly start. So it's much better, and it's appropriate to use basically the only way to get this done without harmful effects to cow health and performance is to use either culture or algorithm-based, or some ways of selecting the cows that can go without getting antibiotics. We later did a follow-up trial from this one using only primipares, and this is a little bit harder to explain, but basically the bottom line information or the take-home message of the second trial is that even if we do some basic testing like somatic cell count or CMT at dry-off, if we don't have any other information, it makes a big difference. So these graphs are forest plots. They're a little bit hard to understand here, but what we did is we said, like, we have cows that we went at the day of dry off, and then they either receive or not antibiotics, but we collected somatic cell count. So we know how much somatic cell count they had, what was the results for the day of dry off. So when we did that, then we separated them. So the cows in the antibiotics and internal teat sealants, or the cows in the internal teat sealant only, that had somatic cell count greater than 50,000 were considered high. And that's the difference on the risk of mastitis postpartum for those cows. Internal risk of intramammary infection with Staph aureus and strep species. But the interesting thing is, like, when we start using somatic cell count, even if you use like a cutoff of 150, for example, what you can see here is, if you check the line here as 1, that means that the difference between groups is the same. So if there is no difference between treating or not treating, the line here that we're seeing will cross with the vertical line that I have. So what this is telling us here is that if a cow has, if we're considering 150, 200, or 400,000, those cows that have high somatic cell count at dry off, they are more likely to have Staph aureus or strep species intramammary infections postpartum. So some of those intramammary infections that we'll treat. On the other hand, the cows that are on the low side of the somatic cell count, so on the cows that had, on that group that had less than 150,000 somatic 1,000 cells per ml, there's no difference. So that's showing that if we do a test, even if it's just like one time at dry off to make the decision, we might be able to implement selective dry cow therapy. And the same goes for CMT. So we look into if it's trace or bar or response. And the cows that, if we consider that the cow has a response, so the cow is positive for CMT, if we don't treat them, they are more likely. So If you don't treat those cows that have positive MT, so here you see the risk is 20% versus 7%. However, the cows in the low group, the risk is 8 versus 6. So it's basically the same. So there's no difference. And we could use CMT or somatic cell count to actually separate those animals before we implement dry cow therapy or not. And the other thing to bring up to your attention is there's always a question of, is it selective dry cow therapy safe enough to be done in cows that are producing a lot of milk? And this paper by Sam, he actually looked into cows from US and Canada from 16 farms, really big data set, and they have low, medium, and high, and here are the actual production at dry off. And they found that independently of production, the risk of mastitis curve, cure rate, milk quality, it's the same. So if they're using either an algorithm or a culture-based way to determine if we can do dry cow therapy, it doesn't matter if you're doing it properly. It doesn't matter if the cow is producing a lot or little milk. The results are the same, and it's safe to go. So some of the take-home message from this part is culture-based and algorithm-based are effective. Hygiene is essential, and dry cow can be implemented successfully in cows with even with high production levels. I'll just quickly go into this high-producing cows that dry off. I know I'm running really late, but when we talked about the internal teat sealants coming as a replacement for the keratin plug, when we look at here, especially on the right panel here, high-producing cows, what's showing here is high-producing cows, if left to their own devices, they do not produce the keratin plug as fast as we think of it. So the graph is showing here that at dry off, 100% of the cows do not have it. But what happens is as we go on and the cows that are producing the most milk, they take longer to have this keratin plug form. And up to 6 weeks later, about 50% of the cows still don't have it. And that is a consequence and one of the challenges of drying off cows that are producing a lot of milk. And that's the case for actually the majority of the cows in the US. And here's some data that we have from farms that we work with here in Minnesota. And the recommendation from the National Mastitis Council is to have cows producing less than 33 pounds. We have over 2,000 cows from 4 dairy farms, and this is the average milk production, milk yield in the last week before dry off. And if you look at it, 93% of the cows produce more than 33. So they wouldn't fit the category or the recommendation by the National Mastitis Council. So the median is actually 62. So the high producing cows is something that's very prevalent and we're dealing with in the regular basis. So what can you do for those cows? And some of the strategies, and that leads into the different grouping to decrease milk production before dry off are decreasing milk frequency. So if you're a 2x farm going 1x or 3x go to 2 or 1x. So you could do that. You can even potentially leave the cows in the same pen, but put bands and they'll go to the parlor, but don't get milked. But that will help it and decrease milk production. You can have different groups and decrease the quantity or the quality of the feed. So instead of feeding them less, which is usually doesn't go well with cows, they don't like not having all the food they have, but you can also have a less energetic diet, and then that will decrease the support for milk production. So they'll decrease the amount of milk they're producing. There were some pharmaceutical compounds that would decrease the production of milk, but I don't think they made it all the way to the US. And the one that we tested was the use of acidogenic bolus at dry off, which will lead them to decrease dry matter intake for 1 day and decrease milk production before dry off. So those are some of the strategies to decrease milk production for dry off. So again, just to stay within the time period that I already exploded, cows, they're producing more milk than they used to be at the end of lactation. So it is a challenge for all farmers, and it's actually there's no good problem, but there is something that was as a consequence of being good in managing cows, nutrition, cow comfort, so they produce more. And there are different strategies to decrease milk production at dry off. Some takes more managing and more grouping. Some are easier, others are easier to implement. So it depends on what's your setup, what you're willing to do to decide which one to take. So this slide just have the take-home message for both parts. So again, culture-based and algorithm-based selective dry cow therapy decrease the use of antibiotics. I just noticed that's missing some words in there. Hygiene is essential, and selective dry cow therapy can be implemented successful in cows producing all milk production levels. And second, cows yielding a greater volume of milk. They are producing more milk than before, and there are various strategies to reduce milk yield at dry off. So with that, that's all I had. Here's how you can reach out. Feel free to reach out to me. I'd like to thank all the sponsors for all the trials that actually led to a lot of the data I'm showing you and support my lab. And with that, I will open the floor for some questions, and hopefully wasn't too late or too long.
No worries. Very good. I think we're sitting good on time. Do we have a question or two from the audience?
I think it's interesting that we have two of the very lowest somatic cell count herds, two of the highest quality herds in Minnesota that are on this call. Isn't that the case, that the people that are already doing a great job want to log on and see if there's something that they can improve on? So Brian and Kathy, thanks for joining us. And we probably ought to give you 45 minutes to hold a seminar on how that gets done, but thanks for joining us.
They're going to have to put years of good management and good practice into 45 minutes. That might be tall ask.
I'll ask a quick question if no one else has one. I read recently that California mastitis test has as much as a 19% error rate compared to doing a more traditional somatic cell count. Should we be worried about the validity of those CMT results with that kind of a false positive rate?
Yes, that's definitely true. And if you think about how doing CMT tests, like, you can understand why you have all these issues, because especially if you're using trace, right? When you start, trace is really hard to find, and you start shaking it and it's gone, and then it's like not reactive. So yes, you should definitely be very mindful if you think about doing CMT. Definitely something to consider. And if you look into that graph that I showed, that's data that we're still working through, the effect of it is not as clear cut and easy to find as we see in somatic cell count, which is a much more objective and reliable test. So that the reason we did that is because we were asked by many producers, like, can I just use CMT? And it's like, well, we ought to test it. And yes, there is, if you have a good training people, it might be something to use, but it's definitely not as reliable as somatic cell count testing.
Good. Interesting. Thank you. Okay, last call for questions, guys. Okay. Well, I appreciate the time, and thank you for joining us, Luciano. Very informative and great.
Yeah. Feel free to reach out if you have any questions.
Absolutely. I can connect our audience straight to you and anything you might want to follow up with.
Thank you.